Good afternoon, everyone. Thank you for joining me on this Sunday afternoon. I do realize I'm competing against the bride that you most likely had. So I hope that you find this presentation informative and entertaining. Today, we're going to take a different tact on COVID. We're going to look at the impact it's had on your business, the business of your practice, and also proactive steps on how one can go about inoculating the effect of COVID against the business of your practice. I'll be covering three talking points. First one, looking back at 2020 and understanding the impact that COVID-19 had on practices, in particular GP practices, given the audience today. Second point, a bit of a speculative view of what 2021 could look like, given the learnings we've had. And then lastly, some practical steps in terms of what you can do in 2021 for your practice based on these learnings. So let's go. The first aspect, impact of COVID on 2020. Looking at our transactional data over the period, really from the first week when the first lockdown was announced, which was the week of the 16th of March, we tracked volumes across all disciplines very carefully over this period. And you can see that this runs from 16th of March to just last week's data. And what I've also done is I've overlaid the different levels of lockdown over the period. You'll see some asterisks on some of these weeks. Those were weeks where there were either one or two public holidays, and obviously that affects volumes for that week as well. And so not surprisingly, you see that straight after lockdown was announced, even the week before that, there was a dip from 90%. So I've benchmarked all these volumes against that first week, taking that as 100% of the base. And then obviously as the first lockdown came in, the volumes across GPs plummeted down to 57%. We then went down to lockdown extension or lockdown season 2, if you're a Netflix watcher, and that continued. And then fortunately, as of level 4, there was an uptake, and in level 3, certainly it took a bit of uptake. And then you could see that in level 2, it kind of stabilized at around about the 70-odd% of what was baselined in that first week of March. And then towards the end of the year, as can be expected, volumes declined towards the back end of December. So this is really a summarized view of what happened across a large base of GPs across our client base. Might be of interest, but if we overlay the average of all the other disciplines, that black line represents our complete client base. And the first thing that we note, or the most important thing that we note, is that towards the end of the year, from August onwards, in fact, GPs were appreciably lower and had more impact than what the other disciplines had, as you can see by the gap between the orange bars and the black line. More importantly, though, is, of course, 100% as a baseline of the 16th of March is not really realistic, because we know that there is seasonality throughout the year. You have the flu season, which is typically busier around about the July period. These volumes are very sensitive, we've realized, after 21 years, of exactly how many business days there are in a particular month, when those business days occur, how they coincide with public holidays, public school holidays, private school holidays, and all sorts of things. And so at Healthbridge, we actually create our own seasonal pattern every year, given all those different dimensions I've just described. And if you compare what we saw, being the orange lines, versus what we would have expected in terms of normal seasonality for 2020, you can see that the sum of the orange and the grey bars really represents what we expected. April, we did expect a bit of a downturn. It was the Easter holiday time with a few public holidays, as you can see there. May, we expected to be quite a strong month. It was a long month, a lot of business days. June, despite starting to be the flu season, a relatively short month, so not as high, and so on and so forth. September, strangely, this year been quite a long month, even though there was a one public holiday. And then October, November, quite crimped once again. So that really describes what we expected, to be fair to this process, versus what we saw being the orange bars. The reality, though, is that when you calculate the gap or the revenue lost across the industry, we extrapolate our numbers across the industry, those orange bars represent the income that GPs lost for 2020. And when looking at that, looking at our data and extrapolating that across all GPs in our country, our estimate is that GPs lost about 1.7 billion rands worth of income over this period from the 16th of March to the 28th of December, the week of the 28th of December. And that's quite drastic and debilitating, as I'm sure you have all experienced. Another thing to consider in 2020 is the consumer-patient impact. And this is a study done by TransUnion, looking at the impact on consumers, the latest one being the survey done on the 4th of October. And what they do is they list the categories of payments where patients are concerned about the ability to pay. In fact, it goes across generations. And what you'll see there is that medical bills ranks up, comes up in this list, slightly different according to different generations. Baby boomers certainly higher, but it really talks about the risk that your practices are experiencing because patients are worried about the ability to pay your bills. And that brings us then to the second part of the presentation as well. Having looked at that with the 1.7 rand impact with consumers struggling, and particularly in the medical aid or the medical bill side as well, what did 2021 look like? And I'm sure you've all seen this meme that initially was July 2020 and was extended to the new year 2021. Certainly, there's a lot of unknowns. I think day to day, the news changes and we are surprised in one way or another, sometimes pleasantly, sometimes not. And so in times like this, the best thing to do is look at possible scenarios. And I put together a picture which maybe describes a possible scenario for 2021 with the best knowledge available today and looking back at 2020. So the reality is that I think certainly from my side is we can expect or we should plan for the fact that we'll have a third wave somewhere in winter. Just the reality of where the vaccination rollout is, I think that is probably a likely outcome or something good and prudent to prepare for from a business perspective. Hopefully, as doctors, you'll be vaccinated with the right vaccine that covers all the variants. Right now, at the time of recording, that's a very topical point. The reality, though, is that your staff members most likely will not be vaccinated when it comes to this midwinter process. And that is an important aspect to consider if you think of this scenario going forward. And you'll see that coming just now. In reality, we can accept that the consumers will continue to find financial pressure, if not increasing, and certainly with a third wave, where again some aspects of our economic sectors are affected, the pressure on the consumers will continue. And I think with these two forces, these two likely forces, it is likely again that, as you saw in those graphs, that the patient volumes will drop again. Unfortunately, that's in my opinion a high likelihood. The fact that your practice staff might not all be vaccinated again introduces the risk of staff shortages, as we know some of you have experienced over this last year. And that, combined with the pressures of the increased financial pressures, most likely will mean that the risk of bad debt in your practice will increase. In reality, though, your fixed costs, your rent and all the other costs, your telco lines and so on, will probably remain. And when you take these three forces into consideration, I think we can expect that there's going to be financial pressure once again on practices, GP practices in particular, around about mid-year, given the patient volumes dropping, the fixed costs remaining constant, and the risk of that bad debt increasing. And together with that, the admin load for doctors will increase due to the staff risk shortages, and of course the financial pressure given the bad debt, and invariably a doctor lands up having to be impacted and get involved. So with that as a backdrop, what are the practical steps that you as a general practitioner and also an owner of a business can take in 2021? And I've got good news. There are 3 vaccines that you can apply to your business. They are double-sided, double-blinded, and they work for all variants of your businesses. The first one being actions you can take to address patient volumes. that most likely will drop. And the very first opportunity for your practices are virtual consults. Philips did a study, 2019, indicating that 38% of South African patients are open to remote consultations, and in fact, even healthcare practitioners are moving in that direction as well. When we look at our data, certainly we saw an uptick as lockdown came in, as you can see there. Unfortunately, though, this was relatively low, with the levels not even reaching 3% of total volumes in practices being virtual. And however, when you look at the classifications of diagnosis, you can see, in fact, that there was quite a wide spread of different types of diagnosis from these virtual consults, of which 27% in total were actually COVID-related. When considering virtual consults, however, there are a few hygiene factors we think that are important. The first is, this is an extended process in a workflow of your practice that's typically very well defined over a number of years. And so you need to make sure that this virtual consult ties into that practice workflow. It needs to be single click, both for you, the doctor, and for your patient, very easy to log on. And very importantly here, it needs to be secure, for obvious reasons, and auditable. And particularly medical aid schemes are quite nervous around, did that virtual consult happen or not? And so the first thing to think about is make sure that you adopt a system that addresses these four issues and therefore doesn't run the rest of your practice aground when you start doing it. The next thing is, of course, you'll be taking clinical notes, but now you will be somewhere virtually relative to your patient. So ensure that that is seamless, always available. Ideally, you should be able to see the patient should be able to see you, and online you should be able to document the clinical outcomes of your consult. So that, again, this is a one-step process, not a two-step process. And lastly, of course, by nature, virtual consults are certainly going to require follow-ups. So make sure that you choose a system that is automated, that is digitized, and will be easy for you thereafter to follow up, be it something related to COVID or a chronic patient. So, and those are just some guidelines that we think are useful when thinking about virtual consults, because they definitely offer the opportunity to make up some of that lost revenue, given the capacity that invariably gets created as a result of some of those patient gaps. The second aspect to improve the drop in patient flow is reaching out to chronic patients. We've all seen and read about stories that there is another concerning factor developing, and that is that chronic patients, with the understandable emphasis on COVID, are not being treated. Those chronic conditions are going to get worse, and as a result, it's good for the patient, it's good for the medical schemes from a long-term perspective, and good for your business to really reach out to these patients. And so think about solutions that allow one to go back in one's patient encounters for a period, maybe 6 months, choose a certain chronic condition that you know is prevalent in your community that you serve, and create an outreach program, either by SMS or email, that says, hey, Louis, you're one of my diabetic patients. Noticed you haven't been with me for the last 6 months. Remember, it's really important to keep track and to monitor and to be proactive about your chronic patient. Please make arrangements to come see me. Alternatively, we can always do a virtual consult and we can have a chat. And as I said, good for the patient, good for the medical schemes, good for your business as well. The next vaccine is addressing the risk of bad debt. And I'm happy to say that this is no new news. Be like the pharmacy. What do I mean by that? Send your claims in real time while the patient is still there and collect the outstanding money before the patient leaves, just like the pharmacy. And the tools, not just with HealthBridge, but across all the range of digital vendors, are there to allow you to do this. The stats you see there are the typical average delays of our client base between the date of service, the day you treated the patient, versus date of submission, the day you sent the claim. And you can see for general practitioners, it's actually a week on average, which is crazy, I think, given the fact that you have available tools to real time. Those delays between date of service to date of submission to when then you reconcile what was paid and what wasn't paid, to thereafter when you go and try and follow up with the patient for the outstanding monies that the medical aid invariably didn't pay, is the biggest driver of bad debt in any practice. And if you can bring that down, ideally to zero, a lot of those issues get resolved. You get a boost in the cash flow and sustainable increased profitability going forward. I really appeal to you to relook the way your practice works and to apply this. We've seen great success in practices that have. The third vaccine you can apply to your practice is to address the fixed costs that exist in your practice. And the first step you can actually do is to move your systems to cloud, to move your computer systems, your practice management system to the cloud. And there's a number of reasons for it. Firstly, it is cheaper than running your desktop applications, both in terms of the hardware that you require and also in terms of the software licenses ultimately. The second important step is that maybe unintuitively these days, in fact, it's safer to keep your data and your patient data and your accounts data and financial data in the cloud versus the desktop. We've had a number of cases where our clients had their practices broken into, not only with the paper files taken, but also, in fact, the computers, which left them with no data, but obviously confidentiality risk as well. And thirdly, most areas these days, the internet bandwidth is fine for what needs to be done. You're not live streaming Netflix, and therefore for the activities that are required to interact via the internet to the cloud, there's typically more than enough bandwidth. So I would strongly suggest, particularly over this time, to do that. As I said, it's a way to ultimately drop your operating costs in your practice. There are some additional benefits of moving to cloud. The first thing is whenever there are pricing updates, and we saw last year, certainly halfway through the year, PPEs could be claimed for. Then rates were increased by Discovery in October with immediate effect. The great thing about using a cloud system is that those changes are made by your company centrally, and the next day you log on, you have those updates. There's no need to go through a big process of updating back to those desktop applications that you might have today. And the second thing that it helps address is that just like an app store on your phone, you have access to different add-ons which you can switch on and off depending on things like the volume of your practice, for example, and where your business cycle is. So it gives a lot more flexibility to take on certain value adds, but also then switch them off when you don't need them, and maybe when things are a bit quiet going on. So for example, in this case, you could switch on your telehealth offering during that period. You might not need it towards the end. And maybe SnapScan is not an add-on you need right now, and so you can reduce that monthly fixed cost because, let's say you're under lockdown 5 and therefore patients won't come into your practice. So it gives you an option to switch on things on and off, depending on where the state of your practice is, again, allowing you to address those fixed costs a bit better. Excuse me. Following on from that, moving to digital clinical notes helps one address quite a few dimensions of fixed costs too. The first thing, of course, is it removes those patient paper files that are stocked up. Not only will you not have to buy them anymore, maybe that's not such a big cost, but certainly those filing cabinets, those ever filling up filing cabinets will stop. And no doubt you've been through a process of having to buy the next filing cabinet, and that can be quite an expensive exercise. And of course, the other unintended consequence is that it takes up costly floor space that maybe you're renting, floor space that could maybe be used as a transition period for a nurse to evaluate patients. Ultimately, it is floor space in the business of your practice that could be removed or could be better used. And lastly, what a digital clinical note should do is actually, the billing thereof should be a natural progression after seeing the patient and documenting what was diagnosed and what the plan was in terms of with the patient while you're in front of the patient. So having documented the diagnosis, having documented the procedures and the medicines required perhaps, the clinical system should automatically generate the billing for you to go into real time, as we spoke about earlier, with the results being back at the checkout counter when the patient walks back to the waiting room. And again, if it's linked to the cloud, that billing should be accurate based on the patient, the scheme the patient belongs to, the contract you might have with that medical scheme. We know that there's a big, wide range of different pricing points. And again, that should be accurate, really coming out of this patient consult. And of course, particularly when you link up to virtual consults, it's available anywhere, anytime, no matter where you are or your patient is. Another aspect of trying to address these fixed costs is see if you can align your suppliers with your revenue. So as your revenue goes down, let's say, over those periods, so do some of these costs go down. And try and align as best as possible suppliers with revenue. Not all of them are possible, but certainly are. Certainly some are. A percentage of billing, for example, to be charged for your practice management system versus a fixed cost will allow you to smooth over those quieter periods. In line with that, also maybe consider the bureau as an option to do some of your admin. Typically, their cost is a function of the revenue collected, so that's very well aligned with your business. There might be instances where there are opportunities to remove some of those fixed monthly staff costs, and certainly in that situation, the bureau could take up some of those services, again linked as a function of your revenue. And lastly, these bureaus typically also have some bad debt collection services, which addresses the other issue we spoke about earlier. So this certainly is another area to consider in terms of aligning your suppliers with your revenue as a means to drop that fixed cost that's always there no matter where your revenues are on any particular month. And lastly, and really only if really needed, consider something like bridging finance. Some of the banks have offered it during the heavy periods for doctors last year. Some of them, as for this one, it's really pre-approved given the transactional flow of the past that certain financing companies are able to look at. I have to say, though, these things typically are expensive, and therefore one needs to ensure that when one does this, it's for good reason, typically maybe to buy an asset that will ultimately generate revenues in your practice going forward. Those are typically for the good reason. So we've had a lot of optometrists, for example, before the Christmas period, taking on some bridging finance to get stock in because they know they're going to be selling that over the December and January period typically. So these bridging finances, as I said, do come quite expensive. They can be there to help one over a certain cash flow crunch, but it certainly shouldn't be used to pay salaries to staff and so on and so forth and keep going over an extended period of time. Really, it's an opportunity to ease over those cash flows for good business reasons. Right, so in conclusion, given everything that we've heard today, I think what you'll see is that despite all the variability in our world right now, at least there are three areas or three dimensions in the business of your practice that you can take proactive action on and you do have control over. Two ways to address patient volumes dropping potentially again through virtual consults and the chronic patient outreach. Reducing the risk of bad debt by changing the way your practice works and starting to send in real time and collect outstanding monies while the patient is still in your practice. And lastly, a number of strategies to reduce the fixed costs that remain irrespective of what patient volumes do. And really trying to link your suppliers back to your revenue in terms of what they charge you. And the good news is that by addressing these three issues, in fact, you then start alleviating those two red spheres on the right-hand side, which is some of the financial pressure will be taken away. One of those vaccines increases your revenue or protects your revenue, and the other two reduces the costs ultimately. And as a flow over to that, of course, then the resulting admin that invariably you may have to get involved in from a financial perspective should lower as well. So I'm hoping that in the end, your quality of life will be improved too. We have two doctors who have taken this step. We have many doctors who have taken this step, but two we have a bit of a write-up on who offered to take them through their experience. They're both GPs. This is Dr. Lee, and this is what Dr. Lee had to say. She's based in Durban. The telehealth solution works like a charm for me and my patients. It's tackling many problems that COVID-19 has brought with it, like reducing stress for the patients as they don't have to come back into the practice, not to mention the fact that it's cheaper and saves on petrol costs. It also saves in precious time too. They arrive and I arrive for the online appointment when we both need to. We get great picture quality, so we get to focus on the appointment and not on the technology. One of the things that I enjoy is being able to work from home. This has helped my secretary too, as the My NPS, the practice management system, is online as well. It's easy for her to book my appointments into the calendar, and the billing side of things is really easy for her too. I like the fact that the telehealth system can be used on any medical aid. It's also robust and just works. I'm a Mac girl, so the fact that the system has thought about a solution that doesn't only work for the Android crowd impresses me. There's a lot of negativity circulating lately about having access to telehealth features. But this has, in a way, kept me positive about my own business. I can just keep on doing what I need to do to run my business. Even into the future, I'll definitely keep on using telehealth. This technology gives me more flexibility, as I've often thought about how I could work from home. When I think of the big picture possibilities, it's fulfilling for me to consider the opportunities for rural populations, as an example. This could allow them access to medical care and avoid the costs of travel. So that's Dr. Lee. And then Dr. Cathro, also based in Durban. Dr. Cathro says the telehealth is really, really easy to use. We were shown how to use it in only a few minutes, and then just a few hours later, we were testing our first appointments. I love that it's easy for my patients to use as well. It's as simple as clicking on a link from their SMS or email. A new page opens up in their browser, and they're in their appointment. No hassle to clinicians or accounts set up, etc. I can definitely see myself using the service in the future too. It's been a great help since the arrival of COVID-19. But this will be useful for me in other ways too. I can be anywhere in the world, on business or holiday, and still look after my chronic patients who need me. And that's Dr. Cathro. Two inspiring testimonials, I think, on really adapting to this changing world of ours that COVID has brought about. Lastly, from our perspective, a big thank you to all your doctors who have been out there on the front line, and your staff, putting yourselves and your families at risk for our health. Small way for us to say a big thank you. And if you'd like to learn more about the Health Coach Clinical, which you still making made reference to by the testimonials, by all means, go through to our blog site. You'll see a link there, and you could then have a call on that. Thank you very much. That's it from me.